Personal trainer practice tests. Question 1. When checking a client's heart rate, what is a commonly palpated site? Femoral artery, jugular vein, carotid artery, tibial artery. The pulse can only be felt on arteries, and the most common sites are the carotid artery in the neck and the radial artery on the thumb side of the inside of the wrist. Question 2. What are the correct units of measurement for calculating body mass index, BMI, weight, lb/height, in, weight, kg/height, m, height, in/weight, lb, height, m/weight, kg. BMI is a ratio of weight to height, or weight/height. You must make sure to first convert height to meters and weight to kilograms. Question 3. You decide to run some assessments to test a client's mobility. Which of the following tests would be most appropriate? Thomas test, thoracic spine mobility screen, sharpened Romberg test, trunk flexor endurance test. Each of the tests mentioned are assessments tools. However, only one of them, thoracic spine mobility screen, is known to assess a client's mobility. Question 4. Jenna has not participated in an exercise program for 2 years. She wants to get back into a resistance training routine to gain strength and reduce her body fat percentage. How many times should you suggest she perform resistance training per week? 2 to 3, 3 to 4, 3 to 5, once a week. A person who is not currently training or is just beginning should start out exercising between 2 and 3 times per week. Question 5. Which of the following mind-body exercise programs is based on the idea that there is a core set of postural muscles that help to keep the body balanced and are essential to providing good support to the spine? This method is divided into 2 modalities, floor/mat work and work on a reformer, Pilates, Tai Chi, restorative yoga, Alexander technique. Pilates is a method of mind-body conditioning that combines stretching and strengthening exercises. The principal goal is to achieve efficient functional movement and improved performance. Question 6. When an anterior pelvic tilt is determined, which muscles are suspected to be tight? Hip flexors and erector spinae, rectus abdominis and hamstrings, gluteus maximus and gluteus medius, quadriceps and anterior tibialis. Generally, the muscles supporting the occurring action, or the shortened muscles, are tight. When an anterior pelvic tilt occurs, it is usually the result of shortened, tight hip flexors and/or erector spinae, causing lordosis in the lumbar spine. Question 7. Which of the following is an example of a summative evaluation? PAR-Q, heart rate monitoring, body fat testing, observations made during the session. An informal observation is considered a summative evaluation of the client. Question 8. Which of the following are utilized for anaerobic energy production? Glycogen, fatty acids, amino acids, oxygen. Glycogen and creatine phosphate are the main substrates utilized for anaerobic energy production. Question 9. Which of the following exercise sets represent a correct recommendation for an individual with anterior cruciate ligament reconstruction, following the guideline of contraindicated, indicated? Stiff leg deadlift, leg curl, stiff leg deadlift, full leg extension, step up, 3/4 squat, full leg extension. Full range leg extensions are contraindicated for individuals who have undergone ACL reconstruction, where step-ups are recommended, along with stiff leg deadlifts, leg curls and 3/4 squats. Question 10. What represents proper form for an abdominal crunch on a stability ball? Lying supine on the ball with hips below the ball, lying prone on the ball with hips on the ball, lying supine on the ball with hips on the ball, lying supine on the ball with hands behind the head, pulling gently upward. The individual should be lying supine, with back on the ball, with their feet on the floor, hips on the ball and head resting in their hands.